Hi, my name is Lindsay Williams, and this PowerPoint will discuss the impact of nurse retention. By the end of this presentation, the learner will be able to explain at least two negative impacts lack of nursing retention has on nursing practice, understand that society will be affected through patient safety without adequate nursing retention, describe how healthcare is impacted when nurse retention is not maintained, and list 3 ways nursing turnover rates can be prevented and retention can be maintained. As nurses, our jobs can be extremely demanding as we hold the responsibility of patients' lives in our hands. The mental, physical, and emotional requirements can be grueling. A great deal of research has been conducted about nurse retention and its effects. In particular, the 2017 NSI Nursing Solutions Incorporation proved that management and administrative interventions for nursing retention are crucial. Not only is nursing practice affected by lack of retention, but the healthcare system and patient safety will suffer as well. An active pursuit of nursing retention is so important. Authors Twigg and McCullough explain in their 2014 article that many contributing factors within nursing practice that is affected by good and bad nurse retention. Research has shown that decreased nurse retention leads to nursing staff shortage. Nursing shortage results in patient overload, causing mental, physical, and emotional stress to the nursing staff. These are listed among the top reasons for nurses' resignations. As nursing staff leaves, some of those nurses are experienced, which leaves the less educated and experienced staff behind to care for the overload of patients. This vicious cycle leads to poor morale and poor practice environment. The 2014 Twigg and McCullough article also strongly suggested that a favorable work environment has a significant positive effect on maintaining staff. A favorable work environment consists of highly educated RNs, adequate staffing, and a positive work environment, all leading to job satisfaction. Goodman also portrays in her image on the slide that feeling appreciated or cared for, caring for returning patients, and being given the opportunity to excel in our career are also great incentive for the nurse to stay. If efforts are put forth to retain nurses, nursing practice would be less stressful and function smoother with knowledgeable and safe patient care. If nursing retention is not maintained, then patient safety will be affected. As Twigg and McCullough state, positive practice environments influence nurses' ability to practice professionally and therefore provide safe, quality care. Inadequate staffing levels will lead to one nurse caring for more patients than recommended. As experienced nurses leave, it leaves less experienced nurses on the floor to care for the patients. The combination of patient overload with inexperience can be detrimental and will lead to a negative practice environment. Twigg and McCullough cite 2008 research article by Aiken and other authors that state up to 40,000 patient deaths can be avoided annually by improving practice environments, nurse staffing, and education levels. To minimize the risk of adverse patient outcomes and to improve nurse retention, management and administration needs to focus on those 3 options. Nurses and patients are not the only ones affected by nurse retention. The healthcare system is impacted as well. In a 2017 article, Yarbrough, Martin, Alfred, and McNeil stated an RN turnover rate of 16.5%, which is almost a 2% increase since 2012. When nurses leave, new nurses need to be trained to fill those positions. When a new nurse is trained, a hospital spends more than $85,000, which is an astronomical amount. With RN turnover leading to high costs to replace those RNs, Yarbrough and her co-authors found that this leads to hospital deficits of over $5 million. As seen on the slide, there is a projected 3.24 million RN growth to happen by 2022. But with expanding patient population and the predicted retirement of 1 million nurses in the 2017 Yarbrough, Martin, Alfred, and McNeil article suggests that this will still put us in a nursing shortage if nurse retention isn't maintained. Hare, Salisbury, Johannesson, and Redfern Vance reported in their 2014 article that healthcare facilities can achieve great financial savings by decreasing their number of nurses. However, another study in 2014 Hare and co-authors' article revealed that retaining just one nurse and utilizing the recommended nurse-patient ratios of 1 to 4 may result in savings of around $140,000 every year. Lack of nursing retention seems to have a negative impact within healthcare, whether it be due to high costs to train new nurses or the cost of inadequate and unsafe patient care. How can this be prevented? Here are some strategies for nurse retention. Factors that research and surveys have revealed to motivate staff to stay include supportive and friendly staff, which involves positive and collaborative nurse-physician relationships. Involvement in ongoing education together is found to strengthen these relationships. Supportive and effective management, where managers are visible, accessible, and responsive to the nursing staff, is also a reason for a nurse to stay on our unit. Learning opportunities that are lifelong and support nurse autonomy. And finally, nurse empowerment. Nurse empowerment can be achieved through a shared governance structure that encourages nurses not only as patient advocates, but also as nurse advocates. Nurse retention is not something that only affects nurses. If not addressed, patient safety and healthcare spending can be drastically and negatively affected. Through combined efforts of management and administration along with the nursing staff, nurse turnover rates can be decreased, which will ultimately improve patient safety by improving and ensuring quality patient care. Increased nursing retention allows experienced nurses to influence younger nursing generations through knowledge and expertise, all while helping to save healthcare dollars by saving patient lives.